Hello, my name is Jenia Chavez Torres, and I am part of the California Institute of Research and Technology. My presentation today is about the health effects of weight bias in the healthcare system, and this presentation was accomplished with the support and guidance of Dr. Bernie. The objective of this presentation is to bring attention to the problem of overweight bias in the healthcare system. I want to bring attention to the physical and mental effects patients have when they are not taken seriously or are dismissed because of their weight. It is important to be aware that individuals have different reasons for being overweight. Ultimately, we want to raise awareness and advocate for a healthcare system that treats everyone with care, no matter their body weight, creating a fair and inclusive environment for all. In the United States, we have about 42% of adults that are overweight. And unfortunately, their weight is not the only thing that they have to worry about. Overweight individuals seeking medical assistance are often presented with extra challenges compared to those individuals who have socially accepted weight and body image. This issue impacts women more significantly because of the differences in women's biological design compared to men. Unlike a simplistic perspective that associates excess weight with everyday habits alone, it is important to understand that many different things can affect why some women may find it difficult and challenging to manage their weight. In women's health, some symptoms are often ignored because they are labeled as consequences of their weight. The usual suggestion to fix everything by losing weight oversimplifies things and hides the fact that women's health issues are more complicated. The consequences of this dismissive approach not only affect the physiological but also the psychological well-being of the patient. Patients who have put a persistent effort to lose weight without success get disappointed and blame themselves. This outgoing cycle makes patients hesitant to get help from doctors because they are afraid to be judged and labeled as lazy and unconsiderate to themselves and their health. When presenting certain symptoms to physicians, their concerns are frequently met with a weight-centric diagnosis. Some of the symptoms and discomforts are headaches, sleep disturbances, irregular periods, breathlessness, marks on their neck and on their arm, a hump behind the shoulder, and some other symptoms not mentioned here. These symptoms are associated with overweight, but they're not necessarily caused by it. They are a correlation to it. Unfortunately, some physicians, when having an overweight patient, only see an individual who is fat and do not explore other possibilities for the symptoms. For example, if you have an overweight person complaining about a knee problem, the physician automatically assumes that it is because of how heavy they are and do not consider other possibilities. But if a patient with a socially accepted weight goes for a knee problem, they are recommended or even sent to get x-rays. Even if the reason for the knee pain is caused by the heaviness of the overweight person, there could be other problems that are not investigated because of the physician overweight bias. This example should paint a picture of some of the issues overweight people encounter. A diagnosis made based on the physician bias lacks the necessary complex and guidance to prioritize weight management effectively. Furthermore, essential information about alternative health considerations is often omitted. Some of the possible diagnoses for these symptoms are polycystic ovarian syndrome, also known as PCOS, a condition that affects hormonal balance and reproductive health. PCOS is characterized by the presence of cysts on the ovaries, leading to an array of symptoms such as irregular menstrual cycles, excess androgen, male hormone, and insulin resistance. Women with PCOS often experience difficulty in managing their weight due to their interconnection of these factors. Insulin resistance is a hallmark of PCOS and can contribute to the weight gain by affecting the body's ability to regulate blood sugar. Insulin resistance is a hallmark of PCOS and can contribute to the weight gain by affecting the body's ability to regulate blood sugar levels efficiently. Another problem could be an excess of stress hormones like androgen and cortisol, which can further complicate the relationship between weight and health. Elevated levels of androgen may promote abdominal fat, while increased cortisol levels can influence appetite and metabolism. It is essential to consider the broad spectrum of factors contributing to weight management. It is essential to consider the broad spectrum of factors contributing to weight management challenges, especially in women. Recognizing the role of conditions like PCOS, insulin resistance, and hormonal imbalances allows for a more comprehensive understanding of the complexities involved, leading to a more targeted and effective intervention for women's health and well-being. Now I'm going to present my case. My case is about a 20-year-old female presented with complaints of mental and physical discomfort. She has some distress that manifests as depression and anxiety, and her physical symptoms are fatigue, irregular periods, as well as marks like thickening and darkening skin, stretch marks, and a hump on the back or back hump. The patient expressed that since she was young, every time she went to the regular checkup at the doctor's office, the doctor will point out her weight and will tell her to lose weight. This continued throughout her life, but her mother's efforts to balance her diet and adapt to a healthier lifestyle did not make a difference to her body mass. She remembers feeling so anxious and hungry all the time. The patient talks about how her mother tried to introduce activities to her everyday life, but she did not feel comfortable doing any activities or even playing with her classmates because she was too self-aware of her weight and body size. These efforts to change diets and activities made her more anxious to the point that she would eat hiding from her mother. On another regular checkup with the doctor, the patient's mother mentioned that her period was irregular, and the doctor offered to give her birth control to regulate her period. But no other options were brought up, except once again, the doctor mentioned that maybe if she lost some weight, her period could go back to normal. There was no explanation of the reason behind the irregular periods. Once again, at age 16, in another regular checkup, the uh, the thickening and darkening of the skin were present. These are called acanthosis nigricans. She also started developing the hump on her back, which is called the cervical fat pad. The doctor tested her for diabetes in the blood with a poke on her finger, but the diagnosis was negative for diabetes. Once again, the doctor said that she was really close to get diabetes, so she should lose weight. Again, no other explanation given to the patient of what that really meant. She was just told that diabetes can be developed when you have a bad diet and get overweight. At this point, patients mentioned that she had tried to lose weight many times with different diets, exercising, and even thought of getting weight loss pills. But, but most of all, she felt that she deserved every symptom that she was having. At this point, she accepted the idea that everything was her fault. She believed that she was a failure, and she felt hopeless and miserable because she could not lose weight. When looking for help to heal her depression and anxiety, the patient discovered that many of her concerns were consequences of her experience as an overweight person in this society, but mostly her interaction with her physician. She assumed that the physician, a well-educated person, knew exactly what was wrong with her and it did not came to her mind that the physician could be wrong, especially since the patient had no health education. After learning about the possibilities of having an actual diagnosis and a possible solution to her health problems, she decided to schedule a doctor's appointment to investigate her own well-being. The patient will request blood tests to monitor her cortisol levels, hormonal balance, as well as an exam to discard the potential presence of polycystic ovarian syndrome. With this new knowledge, she is determined to advocate for herself and her well-being. In conclusion, this research is an in conclusion. This research on overweight bias in the healthcare system underscores the profound impact that it can have on patients' experiences and well-being. By shedding light in the prevalence of weight-centric diagnosis and the dismissal of patients' concerns based on weight, we highlight the urgent need for a more patient-centered approach in the healthcare settings. Importantly, I want to emphasize the crucial role of healthcare providers mitigating bias. A well-educated doctor not only contributes to a more informed and empathetic patient-doctor relationship, but also empowers patients to actively participate in their own healthcare journey. When patients receive comprehensive education about their possible diagnosis, they are better equipped to make informed decisions about their health, follow guidance more efficiently, and educate for their needs within the healthcare system. When patients receive comprehensive education about their possible diagnosis, they are better equipped to make informed decisions about their health, following guidance more efficiently, and advocate for their needs within the healthcare system. Ultimately, fostering a culture of continuous education among healthcare professionals is essential for promoting holistic, unbiased, and patient-centric healthcare practices. I want to thank everybody for watching this presentation. I want to thank the California Institute of Research and Technology for this opportunity, as well as Dr. Benny and Dr. Anise for giving me this opportunity to present. Thank you.